I want to start off by just taking about 5 minutes to talk about where we are in this pandemic, what's going on, the things that are going well, things that are challenges ahead. So if we take a step back and begin with where we are as a country, we have more than 200 million Americans vaccinated, more than 100 million Americans boosted. We have a pretty high degree of immunity in our population. But we're also seeing at this moment a lot of infections across the country. Depending on which tracker you use, we're at about 100,000 infections of cases a day. And we know that the number of infections is actually substantially higher than that. Hard to know exactly how many, but we know that a lot of people are getting diagnosed using home tests. Home tests are great, by the way. I've been a huge fan of home tests for the last 2 years. But what that means is we're clearly undercounting infections, undercounting cases. There's a lot of infections across America. What's driving that? What is primarily driving that is these incredibly contagious subvariants. We were hit with the BA1.1 wave of infections in December, January. We saw BA2, and now we're seeing in a large chunk of the country BA2.12.1. They are more contagious with more immune escape, and they are driving a lot of the increases in infection that we're seeing across the nation right now. And that is a huge challenge. So how are we thinking about this moment? And you'll hear, by the way, more on all of that, both from Dr. Walensky and Dr. Fauci. So how are we thinking about that? Very broadly, and we can get into more details later, very broadly, the way we're thinking about this is we've got to do what we can to prevent infections. We've got to do what we can to ensure that infections don't turn into severe illness. We've got to continue being on the lookout for new variants, new subvariants, continue to do that surveillance. And then last, but certainly not least, is we've got to take a very much a global footing, a global strategy, because we know that there is no only domestic-only strategy to a global pandemic, and that means remaining deeply globally engaged and doing what we can. We've done an extraordinary job of acquiring vaccines and making sure they're widely available for the world. We've now got to continue that work by making sure that we're getting vaccines into people's arms. All right, so I want to talk about two major things, two recent developments that have happened over the last few weeks. And then I also want to talk about funding and Congress. And then I'm going to wrap up and turn it over to Dr. Walensky first and then Dr. Fauci after. So two major developments. If you've been watching, we have launched a third round of tests that you can get from covidtests.gov. What's that about? Why are we doing that? We're doing that because the administration has put in a lot of work and resources that we had from ARP to acquire tests and make sure we had adequate number of tests. Given the spread of infections that's happening across the country, we know use of rapid tests is a very effective way of keeping infections down. You can test yourself before you go to a large gathering, before you go visit someone vulnerable. It is an important way of reducing spread of the virus. Very good evidence that use of rapid tests can reduce the amount of infections that's happening out there. So this is one of the tools we have, one of the capabilities we have. We opened that up on Monday to a third round. We've seen really impressive demand. As of about 20 minutes ago, when we got the latest set of numbers, this opened up on Monday. About almost 8.5 million households across the country have ordered that next round of tests. We have made 8 tests available per order. The reason is in the past we were able to do 4. We've expanded that because of the testing that we've been able to obtain. We know there are multi-generational households. We know that there are households with more than 4 people, and we want to make sure that we make as many tests as we can possibly make available. And so that's getting out there, and I think that's going to be an important part of how we keep infections down. On the issue of how do we make sure that infections don't turn into severe illness, when I came into this job about 5-6 weeks ago, again, under Jeff Zients' leadership, the administration, I think, had done an extraordinary job of obtaining and acquiring Paxlovid and other therapeutics. And yet, 6 weeks ago, despite acquiring all that, the Paxlovid had not started really getting out there. We put in a series of steps. We made it much more widely available by letting pharmacies order directly from the federal government. We expanded test to treat sites. There's going to be more on that coming in the days and weeks ahead. We did a big effort to connect with providers and simplify the ordering and prescription process, making sure they understood what drug-drug interactions really mattered, who was eligible. And then we talked more broadly to the media, all of us did. And what we have seen, I think, is a dramatic increase in the use of Paxlovid, about fourfold increase just in the last month. And our latest estimates are that about 20,000 prescriptions of Paxlovid are being given out every single day. I think that is actually a really important reason why, despite this very substantial increase in infections, we have not seen a commensurate increase in deaths. We have seen hospitalizations rise, but again, not as much as one would have expected at this point, despite the fact that hospitalizations do lag. When you look at ICU care, the rate of ICU hospital admissions is much lower than what one would expect with infections. And then death numbers continue to be low. Obviously, we want to continue to drive that lower. But I really think that beyond the vaccinations and boosting, which are making a very big difference, I think Paxlovid is making a very big difference as well.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.